ng Pilipinas.
A simple smile can change your day and others as well. Studies have shown it has the power to boost confidence, improve social experiences, and make you feel happier overall. But it can be discouraging to show off your pearly whites when you're not confident with them to begin with. The good news is we have a number of procedures available today that can help improve the appearance of your smile. It's called aesthetic dentistry or cosmetic dentistry. On the program today, we'll talk about the aesthetic dentistry procedures that can help address these. I'm Dr. Freddy Gomez and welcome to Medtalk Healthtalk, only on CNN Philippines. Some people with discolored, decaying, or misaligned teeth avoid smiling or even talking. But aesthetic dentistry can help improve the appearance and in turn help build self-confidence. Let's welcome our guests for today. With us is Dr. Cez Acero. She's the head aesthetic dentist at Beyond Dental PH and a professor from the National University College of Dentistry. Also with us is Dr. Maria Janet Mapapandan. She is the president of the Association of Philippine Orthodontists and the chair of the orthodontic section of Asian Hospital and Medical Center. Thank you both for joining us on the program today. Now, early on, we mentioned that aesthetic dentistry improves the appearance of your teeth, your gums, your smile overall. Now, I'll start the conversation with Dr. Cez. Tell us a little bit more about aesthetic dentistry. Is the main goal here trying to improve how the smile looks, or are there health benefits to this as well?
There are a lot of sub-treatments when it comes to aesthetic dentistry to beautify it. That's actually the main goal, but we rarely look into function. And I think the reason why aesthetic dentistry is patok nowadays and very happy actually because patient now has awareness of their smile. So more than aesthetic dentistry being a treatment, it's more of a discipline. It's more of a new concept when it comes to bringing back the new smiles in aesthetic dentistry.
Now, I'd like to ask Dr. Janet, when it comes to cost, especially when it comes to aesthetic dentistry, orthodontics, procedure, braces, covered ba ito ng insurance?
Unfortunately, not all health insurance covers orthodontic treatment because unfortunately, they consider orthodontics as an aesthetic procedure, no? Which is actually, it's not concerned with aesthetics only, but also with the function and stability of the case. We should not confine orthodontics in aesthetics only, like straightening the teeth, because well-aligned teeth also contribute to the health of the structures around the teeth.
Now, let's talk about that a little bit further. How important is it na ang braces na kukunin ng isang tao ay qualified, specialista ang naglalagay nito?
Well, as I mentioned earlier, braces or orthodontic treatment, it's a long-term treatment. So the treatment should be done and monitored and supervised by a qualified specialist because we're dealing not only with straightening the teeth, but how they should be positioned along the bone and how the bite will be, and then also as it relates to the upper and the lower jaws. Sadly, there's a proliferation of the do-it-yourself orthodontic treatment. So one of our campaigns of Association of Philippine Orthodontists is no to DIY braces. Number one problem is it's very accessible. So madali i-order ng mga patients online. And then there's even an instruction on how to put the braces.
Let's talk about what can happen kapag do-it-yourself braces ang ginawa or kinabit ang braces ng isang hindi masyadong qualified dito.
They are not aware of the science of the discipline of moving teeth along the bone. Kasi ang ngipin, hindi lang naman yan nandyan lang. Meron siyang fibers, meron siyang buto na nakapalibot. So if the force or the movement that is placed on these teeth through the braces that they place themselves or placed there by an unqualified dentist, then it will worsen their case. Sometimes irreversible yung damage sa teeth. Nasisira yung surrounding structures around the teeth, and some of them may lose their teeth permanently, and they will end up with more expensive dental treatment.
Doctor says, when it comes to a patient coming to have any dental work done aesthetic-wise, how often does it happen na ito palang gusto ng isang pasyente, yung pala, they need something else? Kumbaga, another procedure is better for what they came there for.
Sometimes 90% of the time, doctor. They would come having these pictures in their hands and telling me, doctor, I want something like this. I want you to give me an 8-unit zirconia veneer. Then when I check their teeth, it's aligned properly. There are just some yellow stains. So what I do is I give them awareness on minimally invasive treatments such as teeth whitening or surface correction lang. So what I do is, let's establish first your good bite, the correct rotation, the correct alignment of your teeth. I refer them to ortho first before I actually suggest another aesthetic treatment for them in the end.
Now, speaking of procedures, there are a lot that are available here, and we'll go through them, some of the more popular ones, when we return here on Medtalk Health Talk. So keep it here. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RPN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
Ay, more than the side of yung maganda, aligned, and maputi, let's focus on ano nga ba yung healthy smile. Kasi yun yung mas dapat focus ng patient eh. Tama si Dr. Janet, it should be aligned because it has something to do with the bite. So, you are confident when your teeth are aligned, not only because of your perception, but because it follows the gait, it follows the stance, it follows you being able to smile and bite confidently, talk confidently. So, I think yung aspect ng aesthetic dentistry in confidence is more on function. It has something to do with confidence because I can function and I can use my teeth for smiling, for speaking.
Let's talk about some of the procedures that are more common here. And one of the really popular ones is teeth whitening. So let's talk about that, Dr. Cesar. When it comes to teeth whitening, ano ba yung mga factors na nagpapadilaw ng ipin, nagpapaiba yung kulay ng ipin aside from it being white?
Usually, stains come from coffee, tea, wine. Yun yung mga usual culprit natin for food. Then we also have other culprits for habits such as smoking, tobacco, that causes nicotinic stains. Yung kahit gaano mag-toothbrush po sila, ay nakikita pa rin natin yung mga stains. And meron din naman tayong brought about post-treatments such as after ortho or maybe after some plaque attachment, nag-yellowish ang ngipin.
Now, Dr. Jared, let's talk about the actual whitening process para aware ang ating mga viewers, especially what expectations can they achieve from this?
For the whitening or the bleaching of the teeth, we refer them to dentists who do this procedure. But the orthodontic treatment, once it's done and all the teeth are well aligned and you have a really nice smile, it enhances the result of the bleaching. It magnifies the result of the orthodontic treatment once these aesthetic procedures are done.
Now, Janet, let's talk about, earlier we were talking about the bite, how it's important for that. Let's talk about that aspect. A lot of people may not be aware of that. They've been chewing their whole lives. How can one tell if their bite is correct or it needs some orthodontic care?
Actually, the patient will notice it only if he has a problem or difficulty chewing or biting food. If a patient has an underbite, patients, unless they have difficulty chewing or biting, that's when they would be aware na baka may mali sa bite ko. Or when they see the dentist regularly, their general dentist can advise them na something's wrong with your bite. Or even if very young patients, I would advise the parents na as early as yung baby teeth pa lang ang mga pasyente, they should see a dentist kasi a dentist can detect if there is a developing bite problem. And this can be addressed early if the problem is severe enough to be treated, no?
Dr. Says, let's talk about another aesthetic procedure, and that is the establishment of a dental crown. Now, there are several materials. There's ceramic, there's porcelain, there's also zirconia. Are there any differences kung anong klaseng crown ang nilagay sa ipin?
They differ mostly in their strength and physical properties. So, if you are to see what material is best to use, it really depends on location. Like si zirconia. Zirconia is known to be very strong. Superior in strength yan compared to an all-porcelain crown. However naman, si all-porcelain crown is superior naman in aesthetics when compared with zirconia. So, usually the zirconia crowns are placed at the back teeth. They stain it with yellow or sometimes with blue stain sa bandang ilalim po para magkaroon ng konting translucency kasi walang translucency ang pure or monolithic zirconia. Ang porcelain naman, they say it's the weakest but it's the most aesthetic. So we usually put that on the front teeth. Here at the front teeth, ang kinukuha natin is yung translucency, yung form ng ngipin na kayang-kayang kopyahin yun ng porcelain.
After the break, we'll talk about veneers, some of its pros and cons, and we'll talk about braces that you can't actually see. All of this when Medtalk Health Talk returns.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RBN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
A person's smile is one of the first things we notice about anyone. And with today's pressures on media and social media at that, a lot of people are going that extra mile in order to enhance that smile. Now, in enhancing the smile, we've been talking about braces, Dr. Janet. Now, when it comes to adults who might need some orthodontic corrections, what are some of the options with regards to having their teeth corrected, but it is not so evident as braces are?
Actually, with younger patients, they prefer letting their braces be seen. No, they like that. It's a status symbol, peer pressure that they're wearing braces. No, but on the other hand, sa adult patients naman, as much as possible, they don't want to be seen having braces. And then we have now the clear aligners. So I think clear aligners is the latest technology, so orthodontic treatment, and it's made of clear plastic na the patients put it, it's removable. So, for me, this orthodontic management or itong mga materials, iisa lang ang goal niyan is to have straighter teeth, healthier and nicer smile, no? But it's the medium, it's the tool that is different. So, it depends on the patient which one he or she prefers.
Dr. Says, let's first talk about what a veneer is. How is it attached to the tooth? What are some of the pros and cons of having veneers?
Actually, this is a very good topic to cover, doctor, because a lot of patients now have a misconception about veneers versus crowns. When we say that it's a veneer, we cover only the front surface of the tooth. It's like a laminate. For the veneers, what we usually do is either minimal veneers. These are the direct bondeds, where you can only remove about 0.5 millimeter or just shave it off, and then put a composite filling on top of it. Or you could also do an indirect, the ceramic veneers. You just have to shave off a little more so that there is retention, and then that ceramic veneer would be done outside. So the direct veneer can be done in one sitting, and the indirect veneer, you would be asked to come back again because it would be cemented on you, done outside of the mouth.
Are there any permanent aspects of someone who wants to have veneers done to their teeth?
Are we talking about permanent removal of enamel? Definitely there would be, because enamel doesn't regenerate or grow back. So it's really a big decision. I call it more of an investment in a big decision when we actually step into aesthetic treatments for our teeth. But there are also other veneering procedure available, which is the minimally invasive or no prep veneer. But not everyone are candidates for this, most especially if there are minor malalignment that would need more preparations or drillings for the proper form to be achieved. It's just a matter of, are you a candidate for it or not?
Okay, so it's very important that you talk to your aesthetic dentist to see which type is best for you. Now, Dr. Janet, can all of these procedures be interchanged? Can someone have veneers and then after having veneers done, have braces at the same time?
Oh, that's a very good question kasi ang dami nagkakamali dyan na patients. So they would ask me, Doc, magpapa-veneer muna ako ha? And then, or bleaching and then I'll have braces. It should be the other way around because with braces, it's a long-term treatment. So if you have braces or brackets placed on your teeth around that time, sayang naman yung na-veneer or nalagyan ng crown or na-bleach na teeth. So I would usually advise my patients that after the orthodontic treatment, then that's the time they can do these aesthetic procedures.
Unfortunately, that's all the time we have for today. But before we go, Dr. Cez, do you have any advice for our viewers, especially when it comes to aesthetic dentistry?
My only advice for our viewers is that you always look into what's best for you and always ask your consultant. I would highly suggest that you look and talk to your dentist about the treatment options that are available for you. Don't just settle for one treatment option. Look into other options, just most especially minimally invasive treatments. Kasi once matanggal na po ang ating enamel, mawala na po siya, it does not go back. So really, if you want to step up into aesthetic treatments, it's a decision. I would really recommend that you look into your options as well for your teeth. Check muna yung mga cavities, check muna natin yung health bago tayo mag-proceed to cosmetics.
And Dr. Janet, of course, any advice for our viewers?
Yes, I would like to advise the patients, the public out there that doing orthodontic treatment or having braces is not only aesthetics. Remember, when we move teeth, nag-i-improve din yung function and we want to give you that healthy, glowing smile. So make sure that please see only qualified specialists. Orthodontics is just part of your aesthetic treatment. We co-manage our patients with aesthetic dentists like Dr. Cez, and then we also co-manage it with other dental specialists. So it's the goal is to give you that healthy and beautiful smile.
And with that, I'd like to thank Dr. Janet Mapapandan and Dr. Cez Acero for being with us today and giving us better knowledge, especially when it comes to our teeth. We appreciate your time and your insights very much. I'm Dr. Freddy Gomez. Thank you for watching Medtalk Health Talk, and we'll see you again next time.